COVID-19 pandemic put a new focus on the struggles facing frontline workers, especially healthcare workers. And even with the height of the pandemic relatively behind us, the work facing Maryland nurses really can be daunting and joyful as well. We're joined now by two registered nurses with MedStar Health. It's Angie McDonong, an RN over at MedStar Union Memorial. Shannon Queen, also an RN over at Good Samaritan. Good to see you both.
Thank you. Good morning.
Angie, I wanted to know what got you in the job, and you had a great story for me. It was your mom years ago. You wanted to be what?
An accountant.
Far cry from being a nurse.
Yes.
Tell me about the change in becoming a nurse, and what does it mean to you?
Oh, mine. I've been a proud MedStar employee as a nurse for 35 years.
Wow.
Yes. And this job really, I love to be a nurse.
Yeah.
This job, oh my God.
That's all right. It shows how much it means to you.
Yeah.
No, I get it. Listen, I'll let you think about it. I'll ask Shannon the same question. Shannon, at some point, you remember in high school or middle school, we took that test. It shows, here's something you're interested in. Did nurse come up on your page?
Not at all.
No.
I wanted to be an English teacher.
Oh, man.
In my early teenage years, my mother was diagnosed with cancer, and I helped to take care of her with her first bout of cancer. And life kind of happened, and I went back. I've always been a nurturer, and I went back to school and became a nurse. Sure. And it's a true labor of love. It's something that I don't see myself doing anything else as well. Sure. It's a true passion for giving back to the community and the people that we love.
Whenever you walk into a hospital, and it's unfortunate for a lot of people when we do walk in, but when we see you working, there's no downtime. I mean, you're on your feet. I see why you wear the fancy sneakers because you're on them all day.
Yes.
Just tell me about the pace. Is the pace the way it seems for us as we're watching you?
Actually, for me,
Yeah.
the face is like, as soon as I get in, my head starts spinning. And I love, don't get me wrong, I love coming to work every day.
Yeah.
And I start my job and, you know,
This job speaks to you. I can tell.
because it's a lot in my
Yeah.
head, like coming through and head like thinking.
Yeah.
Every day I come to work, I think.
No, listen, I can see your heart in it. I see the same thing in Shannon, and we were talking a little bit. We've had some tragedy in family as of late, but it was nurses who ended up becoming part of the family. We knew you by name. If we didn't know you that day, you had scribbled it on the dry erase board so we knew when you walked in. How easy or how tough is that to join someone's family when they're going through whatever they're going through?
Well, for nurses and nursing assistants, we truly become part of the family because we're with them 24 hours a day. We were with them more than the physicians. Families, oftentimes, we're holding their hands. We're seeing them in their rawest form. We're crying with them. And for those people that don't even have family, so, you know, like you talked about your mom, she was lucky enough to have you visit. We have people that do not have family, so we become their family. We hold their hands. We're there when they literally take their last breath.
Wow.
So for us, it is, you asked about seeing us in the hallway. No one could really understand that except for another nurse or a nursing assistant. Sure. You know, we see people pass away and then we're still expected to go to the next person and smile. Oh. No one thinks about that.
Not at all. Not until you just said it.
And then we still have to go home to our families and take care of them and take care of ourselves. And so that's why it's important for us to take care of each other as well.
We invite you here because it's Labor Day, and I can tell from both of you, it makes you speechless. I mean, it's a labor of love. There's love ticking in there.
Yeah, we work 24/7, and we're accountable 24/7. I work days, nights, evening, holidays, and those schedule doesn't bother me because I'm here for the patients and my coworkers. Sure. And, you know, for me, nursing is not just a profession. It is a blessing.
Wow.
Because, you know, in nursing, we learn, we grow, and we give back in a meaningful way. Sure. You know.
Well, I want you both to know you are both appreciated. Thank you, and your whole crew. Let them know that we say thank you for spending some time with us this morning.
Thank you for having us.
Yeah,
thank you.
Certainly.
Thank you.